Hello and welcome. I'm your host, Neil Howard. Thank you for joining us here on Health Professional Radio. In this segment, we're going to have a brief conversation with Anna Lichtenstein. She's a speech language pathologist at the Ohio State University Wexner Medical Center. She's going to talk about gender-affirming voice modification therapy, which is part of a comprehensive gender-affirming care program to help those who are transitioning to find their voice. Welcome to Health Professional Radio, Anna Lichtenstein. Thank you for taking the time this morning.
Thanks for having me.
Well, a bit of your professional background, if you would, and then let's talk about this therapy.
Sure. Yeah. As you said, I'm a speech language pathologist. I specialize in gender-affirming voice modification training for transgender, non-binary, gender non-conforming individuals who are looking for a voice more congruent with gender identity or seeking the ability for better vocal control.
How important is it for a person's voice to match their identity?
Yeah, so gender-affirming care in general can be life-saving. It's important health care in general. When it comes to the voice is very personal. It's very tied to sense of self and sense of identity. And for those who feel as though their voice is not congruent with who they are or how they'd like to present to the world, it can be very important. To some people in their transition journey, it can be very significant at the top of their list and things in terms of the things that are important to them. And for others, it's not even on their list. Some trans people feel confident with the voice that they have and their ability to move through the world and communicate with confidence. So it just kind of depends on the person.
In your experience, has a lot of the decision been based on whether or not the therapy and the surgery and the medications exist or are accessible, or the desire just to not change their voice?
Well, the accessibility and awareness of the services is important, and that's something that we work on as a team at OSU. We want patients to be able to access the services, be able to afford the services if they are seeking them out.
What does voice therapy entail for these transitioning individuals?
Yeah, so typically we start off with appointment with a laryngologist like Dr. Maturka, for example, to talk with the patient, take a look at their vocal cords, see how they move, make sure there aren't any sort of underlying pathologies or incidental findings in terms of their vocal health. From there, the patients are seen for an evaluation appointment with me, and that's kind of like an initial intake where I want to get a good idea of what the patient's goals are coming in, how voice is impacting them day to day. We fill out quality of life surveys and complete acoustic analysis information. So I get an idea of where they're starting with their voice, what kind of baseline information we can collect. And then from there, we schedule ongoing individual therapy and training sessions if we decide that that's the direction we're going. Within the sessions, we learn a lot about the voice. Voice is pretty abstract to a lot of people, and people typically know kind of like the basics of pitch, how high pitch or how low pitch a voice is, but voice is pretty complex. So learning about the different parameters of the voice, things like the airflow and how it coordinates within the different systems of voice production, the pitch, obviously, the resonant quality, so kind of the location of sound and how it reverberates within the body, inflection patterns, so how it moves and how that can be gendered. And we do this through different voice exercises, and usually starting at like a sound level, working up to a word level, sentence level, reading level, conversation, working our way up a kind of a traditional speech practice hierarchy. But learning how to control these skills in a really healthy way is a big part of what we're trying to accomplish. And along the way, providing the patient with as much support as possible. Like I said, what we're doing is very personal, and being able to support the patient in regards to mental health, making sure that they're set up with a whole team of providers, whoever they may need, and helping them reach their goals.
Now, I have learned through this series on gender-affirming voice therapy that we're doing that surgery is not always necessary, not always the option to take. Once someone does go the surgery route, are the sessions, the therapy sessions, vastly different for those who have undergone surgery as opposed to those who have gone the medication, hormone route?
So surgery is an option at our clinic. Dr. Maturka is performing the Wendler's glottoplasty. However, it is not the first line of defense when it comes to voice. Oftentimes patients can meet their voice goals with just voice therapy alone, and it's significantly less invasive compared to the surgery. But yes, therapy is recommended before and after the Wendler's glottoplasty. Mm-hmm. So also Dr. Maturka likes for patients to kind of exhaust some of their voice therapy options prior to considering the surgery itself. So most likely I've already worked with the patient for a little bit. If they're still very set on having the surgery, then having quite a few consults with Dr. Maturka. And then post-op, yes, I am seeing them for voice therapy again because they're working with a whole new instrument. And so learning how to use it, and working with some of the skills we learned before surgery, maybe approaching it in a little bit of a different way, but it's not terribly different. And the voice surgery is a little bit more rare compared to just voice therapy alone. In regards to hormones, majority of my patients are taking estrogen and progesterone, like feminizing hormones, which have no impact on the vocal tract. Which is why more voice therapy is typically involved. I do see patients who are on testosterone or are transmasculine or non-binary, really anyone across the gender spectrum who wants to work on voice. However, those patients are a little bit more few and far between because testosterone thickens up the vocal cords, which then deepens the pitch over a series of months. So sometimes hormones themselves impact voice in a way that feels good to those patients. But yes, you asked about surgery. Voice therapy is still involved before and after, and it's just slightly different because we're not going through a whole 10-week sort of treatment plan. It's approached, as more of like a pre and post-op therapy.
You mentioned availability and awareness earlier in our conversation. Is there a lack of awareness because this is a rare therapy program? Is this a growing field? Is this something that people should be as aware of as many of the other therapy programs that exist out there that have nothing to do with gender affirming?
Yeah, it is a growing field in gender affirming voice. More and more speech therapists have taken an interest in providing this specialty care. More and more graduate programs are providing good education within the voice coursework that they're doing on how to provide gender-affirming voice care, which is excellent. Oftentimes people don't know that this service exists. And so, it's the awareness of the service and the accessibility and availability of the service is important. But like you said, it is a growing field, which is exciting. And gender affirming care, like I said, it is healthcare and something that's being threatened as something that could be taken away by current legislature, which is very upsetting and scary. And so making it clear that these services are important is another part of the advocacy that goes into providing this sort of specialty care for the trans and non-binary community. And we're really proud to be part of such an amazing team here at OSU Wexner Medical Center who are fighting to provide quality services.
Well, give us a website where we can learn more.
Sure. wexnermedical.osu.edu/gender-affirming-care. The whole gender-affirming care website at OSU that breaks down all the different services that are provided.
Anna, it's been a pleasure. Thank you so much for this information. Hoping that we can talk again.
Yeah, thanks so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Anna Lichtenstein, speech language pathologist at Ohio State University Wexner Medical Center. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.